name is Dr. Christina Prabhu.
My name is Onin Desen.
I'm Audra Justine Parker.
My name is Dr. David Sharkus.
Before I had my Scribe, there was always this feeling of tension and anxiety. Adding on a patient meant more typing and more orders to do, and just meant getting more and more behind.
Get up at 7 a.m. and I'd be charting by 8 and I'd chart all day on Sunday.
My hands took a hit. Severe carpal tunnel. I had to give myself a break.
And what you do is you bury your head into the chart, and then Mr. Smith sees the top of your head the entire time.
I was pretty overwhelmed, and I knew that either I could stay in that situation, which I knew was not ideal and was not happy with, or try something new and see if my life can become better.
I've been doing this for 13 years now, and the charting demands just keep getting worse and worse.
My colleagues will say that such a large amount of their time is spent on doing administrative tasks.
I had no idea a scribe could be brought in remotely.
If you can use Aquity to help retain physicians, this technology brings a lot of value.
I'm Robert Stroll. I'm the Director of Physician Satisfaction for Central Ohio Primary Care Physicians. We are an independently owned primary care organization of 350 physicians, 70 clinics servicing over 400,000 patients in and around the Columbus, Ohio area. Using an electronic health record has been extremely valuable in our effort to improve the overall health of our 450,000 patients. However, the burden of documentation is significant and falls primarily to our primary care physicians. So now we're decreasing their ability to engage with the patient. That doesn't really make a lot of sense. So when I heard about Aquity Solutions and their virtual scribe program, I was very excited. We could have someone concentrating on the documentation part, which is very important, and we can get the physician back to engaging with the patient in a meaningful way. And to me, that just makes good sense.
I noticed once I started working with the remote scribe that I was able to actually look at my patients and talk to them, and it has definitely made my encounters more meaningful.
There was not much of a learning curve. In fact, they had told us that we should slow down our patients so that we could bring on our scribe, and I think I did that for 2 days, and then we were off to the races.
My quality of life has definitely improved. I am just much more relaxed.
6 months into this, I would say she can anticipate, everything I might want. She knows how I like things to read. She knows kind of like my style, my writing style, because a lot of times I will dictate. She knows how I like things organized.
It works out exceptionally well. It's almost hard to describe how much it reduces a lot of the electronic health record burden.
I love the way she documents. It's perfect every time I look at it, and there's very little that I have to correct.
My charting time is substantially decreased, and I have a lot of extra free time.
I have chosen to use the scribe to save time, about 45 minutes to an hour a day.
It's just been a better flow.
It gets me going and it makes me move fast, and we just get it over and get it done with, and maybe get home and have dinner with my husband.
When the patient talks, the scribe then reorganizes it in an organized fashion, and that's really important to get into the history of present illness as an organized, medically understandable document.
There isn't much left I have to do at the end of the day.
I definitely think there are a lot more possibilities with a scribe than just documentation.
The scribe allows me to really engage with the patient instead of having my head into the computer.
That I'm able to connect with my patients. There's eye-to-eye contact. The anxiety is down. I feel like I'm doing a better job.
I probably bill at a higher level.
Just having that extra support has made a difference. I'm a lot less tense, less stressed.
The scribe allows me to become much more personable with my patients.
For the most part, I'm able to focus on other priorities in my life, which makes me a happier person, obviously.
And it's been an awesome feeling that came after practicing medicine for 17 years now.
Working with the remote scribing program through Aquity Solutions has helped me work to the max of my potential.
Point blank, it makes you feel like a physician again.
Your quality of life is much better, and right now, quality of life is everything.
This is what physician satisfaction really looks like. We have diverse physicians with diverse needs, but at the end of the day, they all want the same thing. They want to be able to engage with their patients in a meaningful way, and they want to make a difference. And quite frankly, it's been very, very successful. If you like what you've seen and you want to learn more, I would highly encourage you to look at the in-depth videos that we have with our physicians. I think you're going to like what you see. I am Robert Stroll, and I am in charge of physician satisfaction for Central Ohio Primary Care Physicians.
Someone asked me, well, if COPC doesn't support it, what are you going to do? I'm like, I'm just paying them out of my own pocket. I mean, this thing, I'm keeping this thing.
I think we're just scratching the surface with remote scribe possibilities.
Actually, it's kind of like a nightmare that I have, is that someone's going to take my scribe away.
This has made a career that can be really enjoyable, just that, enjoyable.
I'm able to actually find some joy in practicing medicine again.
This is like such a no-brainer.
I really don't intend on going back the other way.
If someone like me who has a hard time trusting others to document can do it, anyone can.
It's a way of life now. I'm never, ever going back.